So if you use your phone and you just call in using the phone number like you do with your mobile, it's fine. It's just like being on a landline. You get into trouble when you try to use the Zoom link on your phone. So hopefully she'll
So
be
there's a way.
okay. Go ahead.
Oh, good to know.
Yeah.
Yes.
Oh, come on. Oh, there we go.
All right.
I could not get unmuted.
Oh. Hi, Janice.
Hi.
So, so far there's 3 of us, so we need one more person to arrive. And I haven't heard from Joanne as to whether she'll make it or not. And we're waiting. Hopefully, Susan is going to be able to call in.
Ah.
Yeah.
Calling in. So Susan M, you mean?
Susan M, yes.
Okay.
Yes. So we're
That's okay.
we're recording. So anyway, I'm gonna, yeah. Hi, Susan Millinger. Oh.
Well, something's happening there.
Yeah.
Susan, can you?
Hey,
Yes.
You're,
Yay.
I'm so sorry to hear you're in the hospital. That's all I know. Something about Sandy. You know, stop. This is Janice.
Yeah. Hi. You can't hear me, I think.
I can. Yes.
We
Oh,
can.
oh,
can hear
good.
you.
Yes.
Yep.
Yeah.
Hi, Susan.
Hi. Hi, Susan.
Yeah, we're going to have to be very careful about initials now because it's going to get confusing.
Yes.
Yes.
So when we finish, we can stop recording so you can catch everybody up, Susan M.
Okay, that sounds good.
So, okay, so we have, all right, let's, I'll call the meeting to order. Oh yeah, Janice Gray, would you be willing to take minutes?
I'll try.
Just
I was going to say I am not in the best shape today myself, but I will do my best.
All right,
I'll try,
Well,
but
hey.
you may need a lot of updating later.
I could listen to the recording later and take and apply it to Janice's notes.
Okay.
Okay, all right, Janice, are you okay with that?
Yeah, okay, so we've called the meeting to order.
At 5:34 p.m.
Okay, I got that, okay.
Okay, and so we'll do a roll call so everybody knows who's here because we have 2 people on the phone. So Linda Ava Scott here.
Susan Gomberg here.
Janice Gray here.
Susan Millinger here.
Okay, excellent. All right. So because until further notice, our town is conducting all meetings remotely. We are going to table the 8/11/21 minutes until our next meeting.
Thank you. And that was Millinger.
Yes. And so the next item on our agenda is finances. And since our last meeting, the only expenditure was $120 for the foot care clients, our subsidy portion.
Okay.
And so that gives us as best as I can tell, our current balance remaining in our FY21 grant is $2,256.61.
Okay.
Okay. Now, the two financial matters that we agreed to talk about during this meeting, I sent out the scans a while ago.
Yeah.
Hopefully everyone had a chance to look them over. So we have the MCOA dues for $230, recognizing that for FY21, we didn't have to pay any dues. Oh, wait a minute. Oh, we lost Susan and now she's coming back. Susan M.
Hmm.
Oh, blast.
We can hear you, Janice.
good.
Grace says you're
Oh,
back
good.
in.
Sorry, I got kicked off. I'm not sure why.
Okay, do you need, what's the last thing you heard?
Well, I am taking notes.
Yeah,
And
I
it's
just
pretty
want to,
simple so far.
I
Says
wonder
Janice. Great.
if Susan missed what she missed.
I just missed us. No, I didn't miss it. The last thing I heard was all of us saying that we were here.
Oh,
Oh,
we
okay.
tabled the minutes.
Yeah, you heard
Yeah, I
that
heard
part.
that. Sorry.
And then I said, I'm sorry, I missed that you went away, because I was looking at papers. I'll just say we said that the August book care was the only expense, and that was $120. We have
Oh,
$2,256.61 is our current balance on our FY21 grant. And so the two financial matters that we're talking about are the Mass Council on Aging dues of $230, recognizing that there were no dues for FY21. And then the Village Neighbors request for regular and dependable annual support of $1,000 or other amount of your choice. And I do want to say that we know that in October of 2020, we returned the $900 to them. That was the original Education Foundation grant for the Aging in Place Task Force. And that we have, from this fiscal year's grant, we have already donated $500.
Thanks. I forgot about that.
so this is Millinger. Can I have a question? My question,
Yeah,
okay, my question would be, so if we give them money, it'll be out of next year's grant, which we don't have yet, but we're expecting?
we can talk about whether we want, if and how we want to go ahead. I just wanted to
Okay.
present the facts so that we knew where we stood.
Okay, thanks.
Yes, so shall we take up the MCOA dues first? You know, in the scan, you can see the benefits of being a member. Yeah, so
This is Janice Gray speaking. I was quickly reviewing my notes from last month, and Linda did point out then that, oh, where'd it go? I just saw it. The main thing that MCOA does for us is advocacy at the state level.
yeah, I mean, in terms, in terms of what I check our COA email, and so I see they send out a brief about every week, and most of what, and rightfully, most of what they are able to provide is a lot of support for the larger COAs that have a center and staff. They do at times have things that focus on more rural locations. But, you know, they do have a lot of resources if we should ever want to tap into them. You know, like if we had a new member and we wanted an update guide to direct being a council member, they have all those kinds of materials that we could access. So that's it. So perhaps we could make a motion in a second and then we can have further discussion.
Okay.
A motion for what?
I'm
Pay the dues?
saying, you know, like we move to approve paying the minutes
Oh,
and,
sure.
not
I'll make,
minutes, I mean dues, sorry.
I knew what you meant, says Janice.
so it's Gomberg. I move that we go ahead and pay the MCOA dues of $230. That whatever, for
Yep.
this time period,
For FY 22.
for FY22.
Okay, this is Millinger. I'll second.
Ah,
Thank you. Okay, now, discussion.
I'll just say.
This is Millinger.
Ray,
Yeah.
oh, I was going to
Go ahead.
second if Susan didn't, because I reconsidered some of my initial opposition from years past. So that's all I have to say.
Okay, Millinger, I really wish they had a sliding scale so smaller COAs didn't have to pay as many dues as the bigger ones that benefit more. But if we think we have the money, then it's probably a good cause to support.
Yeah, that's, I'm just looking, the formula grant, blah, 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 blah. Yeah, it doesn't say if there's, at least just in my reading, it doesn't say if there is you know, if it's based on the size of your population, but
The midway down the second page,
yeah,
when the new federal census is finalized, you will seek a supplemental to adjust your allocation.
yeah, that's for the
Ooh.
grant. That's for the grant. Because it says, please note that despite financial instability that is found in many sectors of our economy, the formula grant remains at $12 per older adult. And when the new federal census is finalized, we will seek a supplemental to adjust your allocation to reflect the new federal count.
Well, isn't the
Oh,
grant
oh.
the same as the dues?
Oh, maybe.
That's how I read it. Maybe I'm wrong. You're more familiar with them than I am, says Gray.
This is Millinger. I'm sorry, Janice, did you say that suggested they have a sliding scale?
Well,
it does, I guess.
sort
You're
of.
right. You're right. Yes. The way that the whole paragraph reads, I agree with you, Janice, that it looks like it is, you know, it is based on per capita. You know,
Whoa.
you all right, Susan M?
Yeah, no, it just seems like, Susan M., seems like a fair amount of money to ask of us when they don't really provide much for us.
Are we sure that does refer to the dues rather than the grants? Because you don't think of an allocation as being some, I thought of it as being the grants at first.
I know it's a funny paragraph, but
Yeah.
Maybe we should wait a little bit longer on this and contact them and ask whether this is a sliding scale they're sending to us.
it says fair share dues.
Oh,
Now that I'm reading it, and And it's back on the, well, anyone who has the paper in front of them or the scan, in on the front, beginning, the third paragraph, it says, to do our job effectively, we need your fair share dues contribution.
Okay.
So it looks, so it does look like, you know, and I'm happy to ask, but I'm pretty sure that, anyway.
Yeah, that Millinger, that does seem to be the implication. I agree. Yeah.
Yeah.
So, I'm not thrilled about it, but I would certainly go along with it.
Skomberg, I agree. It sounds to me like, how can you fight City Hall? We're going to end up paying dues anyway, and they do say it will be readjusted. I guess that could be either up or down.
Mm.
Yeah, although I think like the formula grant, when there's a population under a certain amount, we get a standardized, our grant is not per senior. We get a set amount for the smaller communities. Because otherwise, we might not get as much, receive as much in the grant fund. Anyway, that's just an aside.
Skomberg, I think we should pay it.
Okay, so shall we vote? Roll call vote?
Yep.
If we're
Yep.
all set? Okay.
Gomberg, aye.
Gray, aye.
Millinger, aye.
And Scott, aye. Thank you, everybody. I'll go ahead and do the paperwork for us. And okay, so now we have our village neighbors inquiry.
Do we want to proceed the same way by having a motion and then discussing it?
Yes, please.
Okay, this is Millinger. I move we contribute $500 to Village Neighbors as an annual contribution, and we consider adding to it if it's appropriate in the course of a year.
So this means we've already paid our yearly
No.
500?
Janice says, I'm not sure.
Well, we need a second, please.
Gomberg, I seconded.
Okay, now we can discuss.
Here's my question that I had earlier, which relates to what Susan G just said. So we sent them $500, but was that for FY21 or FY22?
It would have been for, excuse me, excuse me. I believe they made their request in 2020. So it would have been, excuse me, FY21.
Okay.
Because we were waiting, we were we took care of the $900 return first, and then we allocated the $500. So their request is dated July 20th. So they're
Right.
talking about FY22.
Right.
Yeah.
So I don't think we have already paid them $500 for FY22, says Janice.
Correct. We haven't made any donations to them for FY22. We're just still using, we're going to get our grant most likely in the same amount as this past year, which was 6,000, I believe. My memory serves me correctly. Yes. So when it comes around again, it'll be $6,000. And we're allowed to act as if.
Does anyone know what other communities have paid or sent as support to Village Neighbors? Gomberg.
No, Millinger, I think that's a good question, Susan.
I don't know how we could find out other than calling them up and asking. It
Yep.
seems a little tacky, maybe.
We want to just,
No, I don't.
go ahead. Susan?
Millinger, I don't think it's tacky to ask how much they've given. We're trying to figure out what's appropriate for our size.
Well, all the towns are about the same size.
Yeah.
So, and we have to, it is important to acknowledge that Village Neighbors does provide services that we're not able to.
Right.
This is Millinger. Yeah, I 100% agree, and I'm a member, but I think $1,000 is an awfully big chunk of our grant.
We had, didn't we have a recommendation that we would donate $500 and then
Yeah.
reconsider as we see what our needs are?
That was Susan M's motion.
Yeah.
Yep.
Yeah, so that's the motion.
Yep. And that's why I made the motion, because
Yeah.
I think 1,000 is too much to expect of us.
So where are we? Does anyone else have any observations or questions or comments?
Gomberg, none.
Janice?
Although as a personal aside, I've tried to join twice and I've gotten nothing back from them. Once was in response to a written pamphlet, a year ago, February. And I said I'd like to join or volunteer. And then after our last discussion, I sent a request in online and I've gotten nothing back each time. So I kind of feel like I'm being blackballed, Kind of
Sorry, man, this
saying that,
is
but it's
This is
surprising.
Millinger. I think it suggests that there's just sloppiness on their part, because I know they're looking for members. So I mean, I'd be happy to try to talk to somebody in membership and see what's going on.
Well, the one thing I personally haven't done is called the phone number, so I'll do that, and then if I get nothing, I'll see if you can help out. But thank you.
Okay, sounds good.
I like
Millinger.
sloppiness. Yeah, I like sloppiness better than that, paranoia.
Yeah, I wouldn't be paranoid about this. I mean, they are volunteers.
Right. Thank you.
Yeah, you're welcome. Have we heard from Gray?
I'm writing notes here. I'm prepared to support Susan's motion, even though I believe it's already been seconded. Let me just check on that. No, it hasn't.
I thought.
Yeah,
Someone did second it though, because then we discussed it.
Yeah, Susan Gomberg
Sorry.
seconded. Yeah.
Susan Gomberg had motion.
Yeah.
Okay.
Yep, seconded. Yeah.
So I guess we're sort of moving towards a vote, Chair?
Mm-hmm. Yep, I was just waiting to see if Janice had anything else that she wanted to add.
I think Susan M's suggestion is correct, because they do even say the amount is adjustable and the invoice is non-binding. So
Yep. Okay, so shall we vote?
Yep.
Okay.
Gomberg, aye.
Gray, aye.
Millinger, aye.
And Scott, aye. Okay, so I'll take care of that paperwork, with a note saying that this is what we're able to give at this time, and we'll reevaluate as we see what our programming needs are.
Ah, nicely put.
Thanks.
You're welcome. Okay, so the next item on our agenda is the survey, and I would just like to put out that I'd like to hold off until we have Joanne, if everybody's okay with that. Janice Gray is shaking her head.
No, I'm nodding enthusiastically.
Yes, nodding enthusiastically, excuse me. Yes, that's the correct way, yes. And yeah, that's what I would like to do. Susan M and Susan G.
This is G, and it sounds good to me. Let's
Okay.
wait.
Yeah, M agrees.
Okay. Thanks. Um, let's see. All right. The next item I wrote down is our town submission. And
Hmm.
I'm happy to put together a little something. I don't know what we'd say, other than, that about the foot care program, and that we have a vacancy, and again, refer people to Life Path. I don't think we can. Can we refer people to Village Neighbors?
We have sorry, Gray speaking. We can refer to Village Neighbors without giving their URL.
Okay.
So we have included them in our newsletter, our town, and we have included them in the Gazette.
And can we put phone number?
I believe we did. I believe that's what we did. Phone number and post office box. I can go look.
Okay. All right.
But I think we can mention them. I
Okay.
remember we put in something, I think, in one of the two publications, maybe both, about how they no longer charge dues. But we can't list their URL.
Right. Right.
This is Millinger. I think if we're going to support them, it's really important to mention them.
Yes, it's just that there are rules about what we can put in the newsletter.
I agree. I understand. Yeah.
Yeah. So, okay.
We
So,
could even say that we're supporting them.
okay. All right. So if folks are, if anyone else wants to do this, it's fine with me, but I'm happy to do it.
Great, Millinger.
Gray is appreciative.
Gomberg is happy that you're doing it. Thank you.
Okay. All right. Okay. Okay. So the next item is, this is just a little bit, we're going to have just a little report from Susan Millinger about, that she was going to work on and contacting the select board. So over to you, Susan M. If you're up for it.
Yeah, yep, I'm up for it. I wrote a brief letter to the select board and Becky asking that they would hear from Noor and also from me about joining the age-friendly communities that LifePath is sponsoring. And I gave a little detail about it. And I ran it by Linda, and she said it was okay. She made a couple suggestions, which I am following up on. One is to make sure to send it to the select board, not just Becky, and also to include as part of the letter, or in addition to the letter, the model letter that Noor sent me, that select boards would send in. So I have the letter all done, but I'm not very functional in terms of being able to use my right hand to finish it up and send it in, and to send copies to you all, which I'm planning to do.
Thank you, Susan.
Linda has a copy. If anybody is curious, she can bring it up.
And at this point, it may hopefully maybe at the second meeting in September, we might be able to. We'll see. I don't know what the agenda is. I know the 14th is full. So, but yes. So this is pending, and Susan, once we have more information, we'll let everybody know. So if you want to join when it's on the select board agenda, we can, we'll let everybody know. So if you want to come, you can.
We could all show up on
good.
Zoom. Yeah.
Yes.
Good idea.
And I just would like, this is Janice Gray, that Susan did send out another email noting that Leverett has also joined that initiative. I believe,
Yeah.
Susan. So that adds to us being a little island of resistance, which some of us felt uncomfortable about last time.
Yeah.
Yeah.
We said, okay, we can do it now. Well, we were waiting, we were really waiting to see, and now we know. And thank you, Susan Millinger, for, all your work on this project.
Happy to do it. I'm happy to do it.
Okay, so the next item again is grant preparation, which when I did have some communication with Joanne, she said when she felt up to it, she'd start looking into the grant, process for this year. So that's where it sits right now. That's what I can tell you. And I hope that I'll be able to connect with Joanne sometime soon. And, if she's not up for it, then, we'll figure out how to get started, so we can be sure our application gets in soon, on the early side of things.
This is Millinger. That sounds really good.
Okay, so there we go. That's that. And I put website on. I'm not sure why, but I did.
Janice says the reason it's on there, it's been on there for a while because we were talking about trying to update it and include more modern stuff, and kept backburning it because of various other things that seem more pressing.
Yeah. So,
and the other thing is that at the time we started talking about it, some of the things that seemed out of date was about getting your vaccine and all of that stuff, and Medicare fraud. And that was all before Delta.
Yeah.
And
Yeah.
And for example, I now have my booster as a person with a compromised immune system, and maybe something about that could go on there. I don't know. I'm almost scared to touch it, but it is a little out of date.
Yeah. Well,
I haven't looked at it in a long time, which is also is telling that it's probably really out of date.
yeah, I haven't looked at it this month. I did look at it before, and, it would be great if we can get it updated and, when, so we could talk about it next, I have a suggestion. If everyone's okay with this, perhaps we could all take a few minutes between now and the next meeting to look at the webpage and see what we think, and come to the next meeting with some thoughts.
Grace says that sounds good. I think we were going to do that. We got distracted by other things that seemed more pressing.
Yeah.
Yeah.
Gomber says, I think that's wonderful.
Okay.
Good
great.
idea.
Yeah. Millinger says, I think the last time we talked about this, I referred to the data that too few seniors in Shutesbury are vaccinated. It's one of the lower percentages for groups. I think possibly the lowest percentage for age group that's been vaccinated is the older age group. So I think it's definitely important that we include information about vaccinations and boosters.
And yes, I agree. And we have LifePath's information about, their number, I think, is the best number to call, because you get someone will call you back and tell you, about transportation, home visiting for vaccination, that kind of thing. So that really is, to me, the best.
And I think Janice says, I think that's actually still there.
Is it?
Yeah, I'm going to look right now, but I remember it was up there, and I think it's a link to them, which we can do because they are, a nonprofit and a government thing.
Right. It's our area of aging, right?
Life path of the. I don't know. Actually, I'm not seeing anything about vaccines. Oh, it says click here for the latest in the Board of Health. Okay, that's the one that's already up there.
Right.
And it hasn't been updated in terms of numbers of cases in Shutesbury of COVID since April. But it says no for many weeks. So it does talk about COVID testing and vaccinations. I think probably up here, you can find the information you need, but maybe, yeah, but Life Path Vaccination Assistance, there is a link
On the
on our website, yes. Well, actually, if you go to the Board of Health, if you go to their page, they have pandemic information,
right. Okay.
and there's a link there to Life Path. We could talk about calling the helpline and so on and so on.
Right. So we could fix our webpage. I'm looking at it too. We could fix our webpage to include the life path, and we could
Make it more prominent.
reduce the scam alert bit, and
Yeah.
and then put the life path, like kind of put that bit there. If that would, to me, that would,
Yeah.
based on what Susan Millinger said, that's really at the top, and call here for, and someone will get back to you, leave a message, someone will call you back with information about vaccine sites, transportation, and a home visiting if you don't have transportation, or you can't, if you need a home visit for a vaccine. So okay.
Do we need to vote on that? And I'm willing to do that as a stopgap between now and our next meeting.
I don't, Susan, M?
I don't think we need to vote on it, do we?
No.
We don't really have a motion here. We're just talking about
I
content
don't
of it.
know, I'm just
Yeah.
saying I'll do it, so.
Yeah, thank you. No, I think we're good. We're good with that. Thank you, Janice.
Okay.
Yeah, thank you, Janice.
Thank you, Janice.
All right, well, we are through the items we have on our agenda. Does anyone have any unanticipated topics?
At the very beginning of this meeting, Linda, did you say that from now on in the town, all meetings will be remote?
I mean, they have been, and they're going to continue to be.
Okay.
Yeah.
They were trying a hybrid, right, or no?
I guess there was at least one hybrid meeting. That's when the MBLC staff met with town officials. That was a hybrid meeting. But as far as I understand, and when you go to the town calendar and you click on an agenda for a meeting, it says there that it says that statement. So
Okay, thank you.
yeah. So that's
So not the time to go to foot clinic at the town hall at all.
No, which we'll have on our agenda. Our next meeting is October 13th, and so we'll have foot care on our agenda at that time. But as we told I let Vanessa Eastman, our contact at Foot Care by Nurses, that until further notice, we would be at home.
Right.
Oh,
Thank you
good.
for doing that.
Yeah.
Yes, thank you.
That's what we decided.
Yeah.
Because so that's, if there isn't anything else, we can adjourn, and if once we adjourn, we can stop recording. If Susan, you want to tell us how you're doing.
That's okay.
Okay. All right. So motion to adjourn.
This is Gomberg. I move to adjourn this meeting.
Gray,
Second.
second.
Okay. Roll call, please.
Gomberg, aye.
Gray, aye.
Millinger, aye.
And Scott, aye.
Okay.
Okay. All right. Stop the recording.